The patient, Christina, is a 22-year-old Hispanic pregnant female who has been followed by the family nurse practitioner, Meredith, for the last 4 years for general wellness and preventative care. She is now 28 weeks pregnant and was screened for gestational diabetes 5 days before this visit. She is here today to see the nurse practitioner to review the results of the screening. You will meet Christina in the medical clinic exam room as she meets with the registered nurse, Danielle, prior to her visit with the nurse practitioner.
Hi, Christina. It's good to see you. How are you and the baby doing?
We're okay. I've decided to call her Jessica. Actually, I'm a little worried. I'm here to see Meredith about my lab test results to see if I've developed gestational diabetes.
I can see you're concerned. No one wants to have gestational diabetes. Let me check your record. It appears that your vital signs and weight that the medical assistant entered into the EMR are right where they should be, which is good.
I also have a new problem that just started in this week. I've noticed some blood on my pillow several mornings, and that worries me.
Is this new? I know that when I took your oral history, you told me that multiple people in your family have periodontal disease, but that you yourself had no problems with inflammation or bleeding. Has this occurred recently?
Yes, it has.
Would you mind if I do a quick oral screening so I could put the results into the EMR for Meredith?
Sure.
Okay, let me get my gloves on.
Today, Christina will see the nurse practitioner to review the results of the screening. You will see Christina again in the medical clinic as she meets with Meredith.
Hi, Christina. It's so good to see you today. How are you feeling?
Hi, Meredith. I'm tired, but other than that, I'm doing pretty good. I'm really anxious to review the lab test results. Do they show I have gestational diabetes?
Well, I'd rather be telling you that the tests are negative, but they're not. They were positive, and yes, you do have gestational diabetes.
I was pretty sure that would be the case.
I was suspicious too, especially after you told me that your two sisters both had gestational diabetes when they were pregnant. You know, we need to take this very seriously because we need to keep your blood sugars in good control to avoid complications to both you and the baby. So what I'd like to do is I would like to get you in to see the diabetes educators this week. We have a dietitian nurse team that works with our gestational moms. The dietitian will help you make an eating plan that will incorporate foods you like, but probably will be small meals spread throughout the day. It's easier for your body to handle that food and keep your blood sugars from going too high. The nurse will teach you more about what's happening in your body now that you have diabetes with this pregnancy. And she will also teach you how to take your blood sugars at home because we need you to test several times a day to see what your blood sugars do after each meal. Some women get by with dietary management, and others have to take insulin.
This may be a challenge. You know, I come from a large Hispanic family, and we love to eat big meals. And I'm terrified of needles. I really don't want to have to take insulin.
I hear you. A lot of moms feel that way, and we don't know yet. So let's just take this one day at a time and see what happens. Okay? Mm-hmm. I was reading in the nurse's notes. Let me pull it back up here. Oh, you've been having some bleeding in your mouth this past week. How long has that been going on?
It's been about a week and a half.
So I don't like the sound of that. Would it be okay with you if I take a look in your mouth and see what's going on? Okay, let me go get some gloves.
Okay.
Okay, I definitely saw some inflammation along the gum line. That's called gingivitis, and it's actually a bacterial infection in your mouth with the plaque buildup around your teeth.
Okay.
And I hate to put anything more on you, but this is something we need to get on right away too. The research is a little bit sketchy, but they found links between having gingivitis and preterm low birth weight babies, and we don't want that to happen. The way you treat gingivitis and get that bacteria out of your mouth is deep cleaning, and we need to work with a dental hygienist for that. So I'm wondering if you would be willing to get into the dental clinic and start treatment right away. Would that be okay?
Sure, that sounds a whole lot easier than thinking about taking insulin.
So we've covered a lot today. Do you have any questions?
No, I think I'm good.
Well, let's just kind of recap. What we need to do is you need to make appointments with the diabetes educators and the dental hygienist today.
Okay.
I will go ahead and put the referral in the electronic medical record, so it will be there by the time you get to the front desk to check out.
Okay.
And the ladies up there can help you make those appointments. And I'd really like to see you back here myself in a couple of weeks just to make sure we're on top of things.
Christina is being seen in the dental clinic, which is part of the same safety net clinic. She will also be checked by the dentist for other oral problems. This is her first visit with the hygienist and is here to initiate treatment for her recently diagnosed gingivitis.
Hi, Christina.
Hi,
How are you?
I'm doing good.
Good. The nurse practitioner from the medical clinic sent a note over in the electronic medical record that said that you've been diagnosed with gestational diabetes.
Yes, I have.
Well, that's too bad. And she also said that you were having some issues with your mouth as well.
Well, I've had some bleeding on my pillow several mornings from my mouth, and I've also noticed this really bad odor ever since my pregnancy and was maybe wondering if my pregnancy could be causing this odor. Some of the other symptoms I've been having are that I cannot brush my teeth in the mornings because of my gag reflex, and a lot of tenderness and bleeding when I brush.
What I'd like to do today is get some assessment data from your mouth, including x-rays. And it's safe to have x-rays if the baby is covered with a lead apron. And what that's going to tell us is if you have any decay. Sometimes with gestational diabetes, if your blood sugar levels are running high, you have a higher risk of having more decay. And after the assessment, I will have the dentist come in and take a look and check your teeth. Well, Christina, the good news is that the dentist checked and found no decay, and your teeth look wonderful.
Well, that's good. What about my gums?
I took some measurements of your gums with my probe, and what that does, that measures if there's any inflammation around your gum line, and then also measures if there's any bone loss underneath your gum line, and that's called periodontal disease. A normal healthy measurement is between 1 to 3 millimeters with little or no bleeding. And in your mouth, I found measurements 4 to 6 millimeters throughout, and there was moderate bleeding. The bone and the gums are being permanently damaged by the infection. What this means for your pregnancy is that research has shown that women that have this type of periodontal inflammation have a higher chance of having a preterm delivery or a low birth weight baby. That's why it's crucial that we get this infection cleared up. And because you have gestational diabetes, it's even more important that we are on top of things.
How can I get this infection out of my mouth?
What I'd like to do today is begin with a procedure called periodontal debridement or scaling and root cleaning. It's a deeper type of cleaning, and I'll use local anesthetic and work on half of your mouth today. I checked with the nurse practitioner, and she said it's okay to go ahead and use local anesthetic since you're in your second trimester of pregnancy. I'll have you come back next week so we can finish this deeper type of cleaning. It's important that we get this infection cleared up as soon as possible. Then after the baby comes, I'd like to have you come back every 3 to 4 months, and we'll just do a regular cleaning and check and make sure that everything is being stabilized.
So how will I know if the infection goes away?
First of all, we need to make sure every day that you're brushing and flossing correctly to keep that bacteria called plaque out from underneath your gum line. If you can't do this, that infection will not go away. And then secondly, we want to make sure that your blood sugar levels are staying under control, because if that doesn't happen, then the infection will become more severe. Your nurse practitioner and I will be in contact with each other, and she'll let me know how your blood sugar levels are, and then I'll let her know how your mouth is healing so we can have a safe outcome for the baby and for you.
I'm anxious to get started so Jessica does not come early or is too small.
Back at the medical clinic, the patient is being seen by the nurse practitioner for a follow-up visit. She has reviewed the documentation from the nurse, dental hygienist, and the diabetes educators in the EMR. Meredith has called the staff pharmacist to help in professional role-specific information and shared decision-making with the patient regarding the ethical questions related to pharmacological treatment for high blood sugars.
Hi, Janelle. Thank you so much for freeing up some time and coming over to visit with us. This is Christina.
Hi, Christina. I'm Janelle. I'm the pharmacist at the clinic.
Hi, Janelle. Thanks so much for coming. I just need a little more information.
Okay, well, let me catch you up. Christina's developed a couple of issues with this pregnancy. She's been diagnosed with gingivitis and gestational diabetes. Now, she's working with a dental hygienist to treat the gingivitis, and that's actually responding quite nicely. She's also working with the diabetes educators and is following the meal plan they developed, and the blood sugars still aren't where they need to be. So we're at a point we need to add some medication to help control those blood sugars. Christina's not fond of the idea of going on insulin. She's pretty nervous about the needles. And I've shared with her the research that there are options of using pills, that glyburide and metformin have been found to be safe and effective. But I've also shared with her that the American Diabetes Association still holds their position that insulin is the treatment of choice. I'm okay either way based on the evidence. I just want Christina to be able to make the right decision for her and her baby.
Well, I need to make a decision on how to treat my high blood sugars. I really am afraid of needles, but I want to do the right thing for my baby Jessica. Can you tell me more about the pills that we could use?
Sure, I do want to tell you though that insulin is preferred, but we do have other options. We've got metformin and glyburide that have been shown to be effective in gestational diabetes and doesn't seem to harm the baby.
Okay, if we use a pill, is one better than the other?
Well, Christina, if you do choose to use a pill instead of insulin, I would recommend glyburide instead of metformin. Glyburide doesn't cross the placental barrier when metformin does.
Okay, that's good to know. Thanks.
So Christina, with this new information, what do you think?
Well, I've been thinking about this for a long time. I've made a decision. Even though I'm afraid of needles, and now I believe that pills are safe to use, in my heart of hearts, I think insulin is what I need to use to make sure I'm doing the right thing for Jessica.
Christina did well the remainder of her pregnancy. Jessica arrived a few days after her due date and weighed just over 7 pounds. Even though Christina did end up taking insulin to control her blood sugars, she has said she would happily do it again to ensure the good outcome of a healthy, normal weight baby. As mentioned earlier, the Safety Net Clinic where Christina receives her health care serves as a medical and dental home for patients. The model used is an excellent framework to practice team-based care, which was defined in a recent IOM discussion paper as the provision of healthcare services to individuals, families, and/or their communities by at least 2 health providers who work collaboratively with patients and their caregivers, to the extent preferred by each patient, to accomplish shared goals within and across settings to achieve coordinated, high-quality care. We next see Christina about a year later. She has seen the nurse practitioner, Meredith, every 6 months to determine if her blood glucose levels are staying within the normal range. She has continued to see Kelly for regular cleanings every 3 months. At her last visit with Kelly, she talked about being worried about her general health. As a result of this, Kelly has called a team meeting to discuss Christina's concerns. The final scene of this case study takes place in the conference room at the clinic. Team members Kelly, Meredith, and Christina are joined by the medical director of the clinic, Dr. Eli Brumfield.
Hi, Christina. I'm Dr. Brumfield, the director here at the clinic. I'm so glad to meet you. I'm always excited to participate in these collaborative planning sessions with patients. It is an opportunity for each of us to appreciate each other's valuable contributions to care.
Hi, Dr. Brumfield. It is good to meet you.
Well, to start out today, Christina shared with me at her last prophylaxis appointment, and we are doing 3-month interval appointments, that she's really worried about developing diabetes. And that's why I called you last week, Meredith, to set up this team meeting.
I really appreciated that call, Kelly. I think this is a great opportunity for us as a team to work on this issue. So, Christina, can you tell us kind of exactly what you're worried about?
I'm really worried about developing regular diabetes after having gestational diabetes during my pregnancy. My dad has had diabetes for years and has heart problems as well. I don't want to suffer the way he has, and I want to be here for Jessica. I just want to make sure I'm doing everything I can to stay healthy.
I'm so glad to hear you say that you're committed to staying healthy. We always find that when we have a committed patient member such as yourself, we do well. Is it all right if we start with our oral health first, Kelly?
Sure. Her gingivitis has become so much better with her 3-month interval cleanings, but I'm not getting the resolution that I'd like to see. Christina, can you tell us a little bit about your oral home care habits?
Yes, I have been religious about brushing with my ultrasonic toothbrush and flossing twice a day.
Good job, Christina. The daily home care is critical to a healthy mouth. It may take a little more time to get the healthy pink gingiva that we'd like to see when we know that the infection is becoming more clear and stable. What I think we'll do is continue with the 3-month interval cleanings and make sure that Christina is brushing and flossing to take off the plaque that is causing the infection. So Meredith, what insight can you give us from the medical perspective?
Well, what I can tell you is that Christina has lost about 8 pounds, and this is great. Weight loss increases insulin sensitivity, and that in turn reduces your risk for type 2 diabetes. So what have you been doing, Christina, to lose weight?
I have been walking for 30 minutes during my lunch hour every day at work, like we talked about. I have also continued to eat healthy. Like Meredith said, I have lost 8 pounds, but I would like to lose just a few more.
Well, it sounds like you're doing a great job all the way around. You certainly have addressed what you can do to reduce your diabetes risk factors.
I agree. Good job. You know what we haven't addressed is Christina's genetic predisposition to type 2 diabetes. I've been following her A1C levels since her delivery, and they have been creeping up in spite of the lifestyle changes she's been able to make. The last reading, it was 5.9%, just crowding the upper normal. So I've been thinking that perhaps her after meal blood glucose levels are just high enough it may be contributing to the bacterial growth in her mouth. You know, the American Diabetes Association guidelines on prevention of type 2 diabetes suggest we might want to consider adding metformin at this point.
The Diabetes Prevention Program found that in women with a history of gestational diabetes, the addition of metformin with intensive lifestyle modifications has led to a 50% reduction in the development of type 2 diabetes.
I like those odds. I think it will help. And I still want to keep up with the daily exercise and healthy eating.
Well, it sounds like to me we have a great evidence-based team plan approach to help Christina lower her risk of developing diabetes.
And that's a good thing. Christina continue with her new healthy lifestyle habits along with the additional metformin, which is a good drug for you as it is weight neutral and won't interfere with your goal to lose a few extra pounds.
So team, is there anything else we need to reconsider today? I don't think so. I think we can stay on top of Christina's status through the electronic medical record. And should anything happen that we need to talk about, we can easily set up another team meeting. Christina, is there anything else you'd like to talk about today as we wrap up?
No, I don't think so. I feel better now that I will be taking a medication. I was just afraid we needed to be doing something more. Thank you all for meeting with me today.